Infestation. Abnormal activity of the neurons. Okay? So things are firing off. What kind of things do people say trigger seizures in them?
Bright lights.
Bright lights, right?
Sometimes even smells.
SpongeBob.
And Incredibles 2.
Nintendo.
Right? So flashing lights, all kinds of crazy stuff. You'll roll up on a scene, they'll be like, you gotta turn your lights off! What do? Let's turn more strobes on! Right? Alright, so, alright, ictal. The activity of the seizure, right? So we have post-ictal. What would post-ictal be?
After the activity of the seizure.
What do we normally think of when we think post-ictal?
Super tired.
Afterwards.
So how do you differentiate between a real seizure and somebody that's faking a seizure? What's one of the first questions you think I'd ask in regards to? And it all has to do with the post-ictal phase.
How are you feeling right now? Do you remember?
Do you remember what's going on?
Yeah.
So so I'm not even talking to the patient yet, right? So I'm still talking to people that saw what happened. Okay? They're like, oh yeah. So there we were sitting next to him at the bus stop, and he rolled off the bus stop. He was doing this big shaking thing, like boom, boom, boom. He was having a big seizure, right? I'm like, oh cool. How long did it last? And they're like, it lasted like 10 minutes. I'm like, oh, whoa, 10 minutes, right? Is that a long time for a seizure? Right? How long do seizures last? Like 30 seconds to a minute is a pretty extensive seizure, unless they have underlying chronic medical conditions. Like a lot of the pediatrics that have these chronic epileptic seizures can just seize. Like we have a gal over in Station 7's area, over off the Bethel area, that has had seizures where we gave like 15 milligrams of Versed to a 12-year-old girl, still seizing. They looked up her chart and she'd gotten 30 milligrams of Versed at one point in the ER, right? So going back to like the seizure activity, what do I want to know about it? Hey, they're doing this big shaking thing, right?
Did they calm down?
Did they
Did they go to
hit their
sleep
head?
after they were done?
So the first thing I kind of asked is like, hey, so like right before this happened, did they kind of lay themselves down first and then do this thing? Or were they just like, toot, and then you heard a weird noise and you looked over and they're like, and down they went, right? So with those types of presentations, because people will fake seizures all the time. Why do they fake seizures?
For benzos.
Benzos and
Attention.
attention. We got a guy in town. Did I hear a laugh?
No, you're just describing a Pete's mother I had.
Oh, so we got a guy in town. Everybody knows him. He rides the bus. He goes to swimming pools. Okay, he's got two places. He has seizures every time.
Oh,
Oh,
I went on him at Amazon Pool,
oh.
and yeah, the captain like talked to me. I was like the head guard on.
So he was super excited. He's like, he's having a real seizure.
I was like,
he was
oh
one of
my
those
God, he's having a
bystanders.
thing.
One of those bystanders. It's like he's having a seizure. Oh, it's really bad, right? You were.
And then
Admit
the captain pulled me aside and he was like, "This dude like just fakes all the time." I was like,
Right. So what does he do? So
Drives around to the pools.
yeah, so he goes to pools, and what he does is he scopes out his victims, right?
You were a victim.
So he scopes out his victims, and what he does is like he'll be walking along, and he'll find the victim, and weird, every single time it's a female victim, right? So he'll be walking by, and he has the seizure, and what does he do with his hands? Every single time.
Did he grope you, Noah?
So he groped Noah.
"He did not grope me."
But he's a significant groper, basically. He'll have this seizure, fall into the arms of the females, and grope at the same time.
Ever get arrested?
Yes, he has. He is slightly handicapped, but that is still, I mean, his MO is exactly that. Like, we'll get on the bus, we'll climb up on the bus, go in there for a seizure, and we'll look and we'll be like, of course, we got a whole busload of people, right? This guy had a seizure sitting behind or next to. So if they're sitting next to a female, instead of like falling forward out of the chair, it's onto the person sitting next to them, right? So everybody thinks it's a real life seizure. So we'll get on the bus in true fire department fashion and see him like as we're like, Robert, get up! And it's like, what? I had a seizure. No, you didn't. And of course, everybody on the bus is like, what? Oh, because they're all like, no what? This guy's having a seizure. It's a real life emergency.
I didn't know. I didn't see. So they called. They have him outside the pool, and they're like, "This guy's having a medical emergency." And so I had to grab all the bags and like run outside the pool and like.
Right. He's having a real emergency. You sweating?
Yeah, dude. I'm doing that.
Josh, how you doing? You doing okay?
Fans aren't looking either.
Josh is doing okay, dude.
Cautious?
Yeah. He thought about maybe moving out of the sun.
You're in
Yeah,
the sun,
maybe.
man.
I worked by the window that was open.
You were in the sun. Like,
Yeah,
go
just
for there.
try.
All right, I'm down the windows up.
Windows.
Yeah, come to the pool.
I know exactly what I'm
Why don't
getting.
you sleep it like craft? Happy
Yeah,
radio.
it doesn't have to be
Compromise.
all the way
Cody,
open.
It's his
compromise.
birthday.
Oh, we cool for it.
You went for it.
April 5th. Is it April 5th?
Whoa.
Guys,
Gonna be old.
how did you know that?
Good to know. He's stalking you.
You've accepted.
So you have these real seizures versus fake seizures. So some of the things that you do in your assessment as you're asking people, like, hey, what did you see? Be like, hey, yeah, so when they stopped seizing, were they totally awake right afterwards? Or were they unresponsive for a while? Okay? So a lot of times what's going to happen is people that immediately wake up, real seizure or not? No. If somebody has a post-ictal phase, right? And it will last, they'll be unresponsive, right? So early on, I think I told you guys about our CCR that we had. Like, we were like, hey, we're doing the CCR thing, this is what we're doing, everybody gets an IO, blah, 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 right? Dude has a seizure, so we're just like full pit crew style, we're like, right? Dude, I stuck an IO in a dude that had a seizure, right? And it's like, kind of figured when he went, when I pushed the fluid in, I was like, oh, I don't think this is a cardiac arrest after all, right? So it's one of those moments where it's just like, oh, okay, so you're unresponsive for a period of time. Some people will take longer, some people will take shorter, okay? How can we clear up that? Because what happens during that seizure, do people continue to breathe?
And seizure, no.
Usually not, right? So what color do they turn? Everybody says.
Blue.
They said they turn blue, right? They're not breathing, right? So we'll commonly go on cardiac arrests that people will say, hey, the person's not breathing, ineffective breathing. They'll say it's a CCR, we get there and it's a seizure. At the same time, people will say, hey, you're going on a seizure patient that turns into a cardiac arrest because people have that twitching when they die motion that people think it's a seizure, but they're actually dead kind of thing, right?
So is that why it's extra important to check a pulse?
Yes.
And put on a monitor.
Extra important. So that was the thing. So that CCR that we had, so we were moving fast and everything like that, and we actually started compressions and everything because the dude had a weak thready pulse, but nobody really, like, we're like, yeah, no pulse, boom, do our thing, right? And so that's why you take that extra little second. Is it my pulse or is it the patient's pulse? What do we got going on there? Yes.
Do you ever get people with the diagnosis of pseudoseizures?
See, okay. Once again, lab number 2 does it every time.
It's just Annalise.
No.
I was thinking.
We had a bunch, yeah. So pseudo seizures. What does the word pseudo mean? So when somebody tells you they have a diagnosis of pseudo seizures, what do you do in your head?
I think it's fake. But
You laugh, right? Like not out loud, not out in front. I mean, you take your hoodie and you're like, or Mark, you just,
Who's this doctor?
right? So pseudo seizures are common diagnosis, right? It's basically the doctor's saying, hey, knucklehead, you don't have seizures, but in order to make you leave and not come back, I don't want to see you anymore because you have psychiatric issues. I'm going to say that you have pseudo seizures, right? I'm not going to give you anything. I'm not going to prescribe you anything. And so, because most of these patients continue to say they have seizures, no post-ictal phase, they do this, and ease themselves down onto the ground, or they'll be like, I'm having one of my pseudo seizures. It's happening right now. And it's like, and that's right as you're getting ready to walk away.
Is it or is it a conscious choice?
It's a conscious choice.
Like they're just out like,
Yes. Yeah.
now is the time. The time is now.
Well, so like our dude, the groper, he could be diagnosed with pseudo seizures if he were to go to the doctor and have an eval and say, hey, yeah, you have these things, because he just Because he could say, yeah, you know, I go unconscious and this is what happened, da, 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 da. Like, the doctor never will witness it. He's like, okay, what you're describing is not really a seizure, but, okay, you say you have seizures, so we're gonna give it a title of the pseudo-seizure. I don't believe it's a real seizure. I don't believe it's neurological. I believe it's psychological in your cause. Okay? It's a pseudo-seizure.
Do you need to transport?
Transport what?
Why?
A pseudo? A pseudo-seizure? We have to transport anybody that wants to go, right? So if they want to go to the hospital, we transport them. But if we know our stuff, we can commonly tell them and use the right terminology and the right verbal judo to not transport them, right? It's like, oh yeah, you're probably gonna be fine, but they're like, no, I need to go and be evaluated. It's like, okay.
You're gonna sit in the waiting room for 5 hours.
Yeah, and that's what we say. They're like, we're like, hey, you're gonna go to triage. Like we'll type and say pseudo seizure specifically in order to pass that information on to the next care provider, so that they're aware. Oh, okay, pseudo seizure. Because that's what you do. You smile when you walk in. You get to pass off a pseudo seizure to a nurse, right? Like, oh, hey, this is so and so. He says he's got a history of pseudo seizures, and instantly you see that they're like writing, and it's like. And then what am I doing? Right? I just smile. I was like, I got you good. Have fun with this one, right? And so it's just that kind of a thing. It's like,
You walk into the ER and you just go straight to triage. You don't even go into a hospital, right? ER, right?
oh no, I've dropped people off at the front door.
Like, just get out of
In
the
front of the ER.
Yeah. Like I've rolled in through the front door before.
Do you take them in or you drop them
Oh
off?
no, I walk them in and be like, hey, so yeah, hey, here's check-in. There you go. Yeah, I'm leaving. See ya.
Just stand at the corner and walk right back out.
I watched you do
No,
that,
because
actually.
they want to be there, right? So then I make my way back to the chargers and be like, hey, we just brought this guy in because we have to give a report, right? We can't just dump load.
Do you give it to the triage nurse or charge nurse?
I give it to the charge nurse or whoever. Mostly it's a charge nurse, whoever is there. So usually it's an ED is where we do those.
Yeah.
And so you just walk back to the charge nurse and be like, hey, brought somebody into triage, just so you know they're out there, see those seizures, everything's stable, everything's good. Questions? No? Okay, cool, brilliant. Right, it's one of those kinds of things. It's like a quick, 10-second, and we're out kind of thing. Still gotta write a chart for it, still gotta do all that stuff. Passed off patient care to a nurse, right? Does this person need a hospital bed? No. They can go through the proper channels to get it, okay? Epilepsy. Do people that have epilepsy want to be transported?
No.
Not usually, right? So when somebody has epilepsy, what do we normally want to ask them and talk to them about?
How frequently do you have seizures?
Oh, medication changes, right? So if somebody has epilepsy, are they on meds usually?
Yeah.
Absolutely, they got something, right? So how common and how often do they have them? Was this seizure any different? Because anytime you have a different presentation in seizures, they need to be evaluated, right? Something's different, something's changed. If it's happened more frequently, just any sort of difference or change in the seizure-like activity and behavior warrants follow-up.
Well, they
Okay?
wouldn't have, I guess if a,
Some bystanders.
bystander.
They won't call, right? Because they're unconscious and unresponsive, right? You will occasionally get the call of the impending seizure, or I've had a seizure and I'm the caller. Seizure's done and over with, but I had one and I want to be
so
evaluated.
that's like, they call if they're like home alone and they feel it coming, and they're like, I need someone here.
Right. So some people will have animals that can sense it beforehand. Those are actually pretty
Friend of mine.
pretty awesome. I mean those animals, how they can pull that off, I have no idea. Like there are some pretty sweet YouTube videos where they're like there's one that's a younger gal, but is home with a dog, right? She has a seizure. The dog comes over, basically opens up her airway based on the head position and everything, and keeps her and snuggles her while she's having her seizure. I'm like, dude, I want that dog. I was just like, I just want to be on my deathbed with that dog, right? If I'm gonna die, I want that dog with me, right? Super awesome. I'm like that. I mean, I don't know what kind of training the animals have to do and how they sense when the seizure's gonna happen, but they're there, it's immediate, it's just like, wow. And so when people say they have the service animals and stuff like that, we don't have the right to ask what for, we don't have the right to do any of that stuff. We don't normally take animals in the ambulance, right? Why do we not take animals in the ambulance? Because they bite, right? Like, my favorite thing to do is I love little yanker dogs. I mean, don't judge me, but I'm just like, I'll kind of test them with the leash, like how well I can lift them up, and then I'm just like, I'll lift them up by the leash, and then I'll try and give them a little assistance. And if they go for me at all, I'm just like, nope, okay, here we go, and in, and then I just close the door.
What if they're a puppy?
Puppy, I love puppies.
Just take a puppy in the back.
Oh, I'll take a puppy in the front if I'm driving, right?
Get the dog out the
Yeah.
window.
Oh, no, totally.
Yeah.
Right? Love the animals, right? Love puppies, love the animals. So,
Who is?
so,
I thought she was gonna be like a shit ton of Caucasian.
so we try and make, because we can't just leave the animals on scene. A lot of times people that have service animals, a lot of them, they're not at home, because some of the times they're like, hey, my dog can stay home and they can be here, just make sure that, because I mean, we feed, we water, we make sure the animals are set. Hey, do they need to go in the backyard, front yard, kennel? Like, we take care of that kind of stuff. But a lot of times when we have to take them is they're at the stores, they're out and about. They're somewhere that it's not their comfort zone, right? And so 99% of service dogs are well behaved. They have the training, right? They wouldn't be around people all the time if they weren't well behaved, right? So most of those dogs are super mellow. Hey, come on, Bob, get you in there. A lot of times I'll just put them in the front seat, crack the window a little bit, let them hang the head out as we go to the hospital. I was like, those are the fun ones. I'm like, hey, you want me to run the siren too? Right? That kind of thing. So epilepsy. So what do we do if somebody has a seizure? We get there, seizure stopped, have not regained consciousness, boom, back into another seizure. What do we call that?
Status.
Status epilepticus, right? Hey,
Hi,
what's up?
Sarah.
Oh,
Hey.
Yeah.
Dude, you are
Whoa.
ready. Sweet.
Oh, he's just a lucky guy.
Need to move it. Hey, Janae.
So
can you-
status,
can you
right?
see
So
that?
status epilepticus.
Does Sarah want to sit here? Sarah, do you want to sit here? Do you want to sit here? Let's trade seats.
Janae, do you want here?
Good, I'll stay there.
Sweet.
Oh,
Crash
awesome.
course.
There you go.
That's a
Crash course.
transportation class right there. That's what I see. You should definitely get involved with driving those ambulances.
Well, that
So status epilepticus, right? Constant seizure, no lucid interval, back to seizure again. Is this a life-threatening emergency potential?
Yes.
Why?
Because the airway, if they're not breathing during all those seizures, they're consistently hypoxic.
Okay, but so during those periods in between seizures, do they start to breathe again during that postictal phase? So most of the time they are going to regain, right? And so during that period, hey, you're good to go, right? But what happens when they go into another seizure? And then another seizure?
Right, and
So
it keeps
does-
getting longer and longer, and so.
Right. So like your lucid interval, a lot of times will get smaller and smaller and smaller to the point where there is no period of stopping, right? So it's at that point when you hit that point where it's just like, boom, we're in seizures nonstop, right? So what's our treatment for seizures? At least you didn't dodge it.
Where it says, I had a question,
Oh,
or
we're back to
more
questions.
something else.
Come on.
I would just have a concern for hyperthermia,
Hype.
because of all the activity.
Mhm. Okay. Well, the cool thing is, you know, if you wait, I think just a little while. I really appreciate Lab 1 really holding off on the fast forwarding of the questions and stuff.
What were you being concerned about?
Good. Yeah. So back to Versed, okay? How much Versed? Chad, you're killing me.
Let's see, 4 IM, 2 A.
4 a.m. 2 IV. What do you guys think?
Opposite.
I think it's gonna work faster. I have an onset of.
You said
about 20
4
minutes.
a.m. Oh,
How
yeah.
many minutes?
Yeah.
For
How many
IM,
minutes do you say, Allie, for IM?
it's about 15, 20 minutes.
way quicker than that,
Way quicker?
way quicker.
Maybe.
It'll take roughly 5 to 6 minutes maybe.
For IM?
Then
For IM,
maybe
yeah.
he needs to be
IV, how long does IV take?
Instant? Or one?
23 seconds.
Yes, they are seizing, that's why we're giving the Versed. Oh. So you guys weren't prepared, like, patient was seizing when you walked in kind of thing?
Sure.
Okay.
Stop and get an
So you guys remember that IV attempt that you guys were trying to start on me when we were doing our little thingy over here?
Yeah.
That's kind of like trying to start a seizure, or just a IV on a seizure, right? It takes like 5 people to hold the arm down, you're bouncing, you're moving, you're trying to do it, and then eventually you go to jab the person, and you completely don't even jab even, you're like an inch away from where the vein is, right? So then what happens once you jabbed in and you're in the wrong spot? You guys do like a 90-degree turn in the arm, trying to right? That's what you guys do as students. I'm watching you guys try and do that with the mannequins and stuff, right? So with us, what do? We just pull it out, and we grab a different needle, and then we try the second time. Be like, hey, I was, I'm just trying to teach you guys the right way, Chandler, the right way. So, Chandler, now that you got your IV, what size IV did you want? 18. What color is? Oh, hold on. Hold on, I need the ball first. What color is an 18?
Green.
Oh, okay. What color is a 20? What color is a 22?
So much.
What color is a 22? Oh! Oh, it's coming back. Oh, it's coming back. Oh, Jesus.
Whoa.
Are we ready? Here it comes in slow motion.
Oh my god.
How about a 24? Oh my goodness, it's the whole two-hand thing.
Yeah.
See? So it's like,
Maybe she had a stroke.
oh. I would ask Mons to do a stroke assessment, but we've seen how that goes again today. Right?
On the way to the hospital.
So why do we want an 18 gauge on this person?
Because they're gonna be pushing, contrast, as an 18 gauge above the wrist.
Right. So because what are some of our causes of seizures?
Stroke.
Strokes, right? So they're going to end up potentially, depending on if they're epileptic or whether or not they're not, new onset seizures, they got to come up with a cause, right? So you're going to do a head CT, so you can have tumors, you can end up having bleeds, you can have all kinds of different stuff that cause the seizure, right? So they're going to do the contrast CT or non-contrast CT, but they're going to need, where does it go?
Above the wrist.
Proximal wrist, okay?
What do you think about?
Oh, I love things.
If you showed up and someone was actively seizing, so you walk in the door, they're actively seizing, and the first thing that you do is give an IM of Versed, because it'll take about 5 minutes, and you do a repeat dose after 2 minutes as needed. So you do IM first while you're trying to get the IV.
People like that idea.
Seems like a smart idea.
Wait, keep your hands up.
Oh gosh.
Okay, let's see. 1, 2. Oh, Justin, you can't be wishy-washy. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18,
About more information.
20. Okay. Oh, man. So, okay. Here you go. So there's your Versed. Let me get your syringe for you.
Okay?
You're going to have to drop the syringe. You're going to have to draw it up, okay?
Pull it out.
And while you're drawing it up, who do you think is the fastest IV starter in here?
Michaela.
Michaela. You're going to start the IV, and I bet you can have the IV done before he can even have that drawn up.
We're gonna test
Wild.
that.
Yes.
On a shaky arm.
No.
Fair point.
Wild
Wild.
No, that's not gonna happen.
Oh,
Don't be
God.
ridiculous.
Have I said Andrew was wrong yet?
No.
No.
Okay? But you guys automatically started because I start painting this other picture, it's like, okay, maybe you start becoming wishy-washy on your decision, right?
Let's stick with it.
How many people still want to stick with giving an IM? Okay, so it's the same number. Did anybody change? Did anybody become wishy-washy? Okay, I agree. You would give it IM, right? Because it's a quick thing, right? Boom. It's gonna give you time. And what happens if it works IM? By the time you get your IV and stuff.
Well, sweet, you already have that?
Problem solved, right? We're there, right? So you can give it IM, knowing that it's gonna take a little bit of time, because all you really need is a syringe and your vial, right? Michaela, as good as she is gonna need extra help to hold the arm, right? Because, never mind, see, filter, boom, filter here, not filter here, right? And so you have, so you'll have that decision of being like, okay, is this a small person, is this a big person? If this is a kid, you can probably have an IV very quickly, right? Because it's real easy, hold the arm down, do the IV, right? So a big giant person, lots of mass, trying to hold down, moving, stuff like that, it's gonna be a lot harder to hold and muscle that arm in order to hold it.
It's not like they're flaccid though, their nerves are like firing and the muscles are tense and wouldn't it cause injury just to hold it down when the
No,
muscles are
no,
going?
not at all. And so basically all you're doing is you're just holding it still, right? So the rest of the body is still moving, right? But you're holding that arm still, just in an attempt to get your IV established. Okay? So you're not gonna cut. So what is our job usually, if we don't have anything available to us? What is our job when somebody has a seizure?
Make sure they don't hurt themselves.
Protect them.
Yeah, protect them from further harm, right? Like seizures normally will stop, right? They're gonna run about 30 to 60 seconds, and then they're gonna stop, right? And so it just kind of happens where, like, you're not super concerned with how things work out in the long run. Okay, let's take a break. I gotta take a break.
What